welcome to the fourth installment of the SEIU-UHW COVID-19 update. My name is Dave Reagan. I am the president of SEIU-UHW. And on Wednesday evenings for the last 4 weeks, this being the fourth week, we have made the decision that we want to join together and bring all of our members, and in some cases, family members and neighbors and friends together to give the best update we can as an organization of healthcare workers, primarily hospital workers, about what we're experiencing around the state of California. I think everybody's aware that when we began these 4 weeks ago, the world was a very different place. And today we exceeded 200,000 confirmed cases across the United States. We're now above 8,000 cases in the state of California. And obviously this has become an event and an ongoing event that has just taken over our lives and changing all kinds of things about the country. So as we've made the commitment to do, we have a combination of guests here tonight. We're going to try to focus on some of the issues that we think are of the highest interest to members of UHW around California. We basically understood and learned from the first 2 sessions that we did that there's so much interest and there's so many questions and so many of them are similar that we've made the decision that we're not going to try to take live questions, but instead we're going to try to be as responsive as we can to what we've been hearing from you all across the state in the past week. So tonight we really want to focus on what we as healthcare workers and what we as members of UHW are doing day in and day out on the job to deal with the crisis as it's developed. We want to focus on some of the public policy and the governmental dimensions of what's taking place here. And as always, we have a set of our member leaders who are going to join us tonight, and I want to give them an opportunity to introduce themselves before I introduce a special guest that we have. So I would ask the moderator to allow our 4 member leaders to introduce themselves, and I think we're going to start with you, Yvette, in Southern California.
Hi, I'm Yvette Hurston from Southern California Kaiser Call Center.
Great. And next, moderator, if we could, which one of our 4 members, or go ahead, Georgette.
Good evening, everybody. My name is Georgette Bradford. I'm up in Northern California as Sacramento Kaiser, and I'm an ultrasound tech in the radiology department.
Great, thank you. Next, we'll hear from Kevin in the middle of the state.
Good evening, everyone. My name is Kevin Barraza, and I work in nutrition services at Dominican Hospital in Santa Cruz.
Great, thanks, Kevin. And finally, Leah.
Hi, my name is Leah Harcourt, and I'm in Northern California at Kaiser Walnut Creek in the inpatient pharmacy.
Terrific. So as I said a moment ago, in a little bit, we're going to hear from Georgette and Yvette and Kevin and Leah about what we're doing as union members and union leaders to deal with a whole range of issues inside of the facilities and among our coworkers. But before we get to that, we're really pleased and honored to have with us tonight a member of the United States Congress. She's a member of the House of Representatives from Orange County in Southern California. And frankly, she's gotten a lot of attention lately in a way that I think it's fair to say from all of us in UHW, we really appreciate the efforts of Congresswoman Porter. About 2.5 weeks ago, she did an absolutely fantastic job of grilling the head of the CDC about the importance of not only being able to test people across the country, but to be able to do that in a way that didn't assume that millions of people have over $1,300, which is about the estimate for what it takes to get a COVID test if you don't have that covered in your insurance. And so Representative Katie Porter has really been a champion of standing up for people to deal with this. She herself had a bit of a scare around this disease, and we're glad that she's doing well and feeling well. And the final thing I want to say, Congresswoman, is that in the last week, Congresswoman Porter has also authored a letter that went out to both the CEOs of Fresenius and DaVita, the two largest dialysis companies in the United States, and places where we've been engaged in an ongoing campaign. And so on behalf of all of UHW, we totally appreciate your efforts, both on the COVID-19 crisis and also to stand with us as healthcare workers vis-a-vis the dialysis industry. And so I want to begin, Congresswoman, by giving you an opportunity to introduce yourself, but then to also talk about your perspective on what you've learned and experienced around testing and any other issues around COVID-19. And again, thank you for being here tonight.
Yeah, absolutely. Thank you so much, Dave, and everyone for coming on tonight and for all that you're doing on the front lines right now of this healthcare crisis. I hear every day from constituents who are so grateful. They're so grateful for what you're doing as frontline workers, for your sacrifices, for your bravery, and for the compassion of care that you're bringing to this situation. So just thank you so much for the lives that each and every day you are saving, and for the quality of life that you are giving to families and to patients and to healthcare workers as well, taking care of each other, taking care of nurses and doctors, and the entire healthcare ecosystem that you are the glue that holds all of that together. And as we've heard a lot of talk about doctors and nurses, I just really want to say that I hope that you are also hearing how important you are, and that I see that I think patients see that, and that I hope that doctors and nurses, hospital administrators, and others are expressing to you how important your role is in this healthcare delivery system and in this pandemic. So I wanted to also give you a little update on some of the things with the CARES Act. But before I do that, I wanted to tell you how personal this issue is to me of protecting healthcare workers. My sister is an ER doctor. She's not currently practicing, but my brother-in-law is. He's in Texas in an ER day in, day out. He's been going in, and there's severe shortages of personal protective equipment. He was also told by his employer that he couldn't tell anybody about them, that he wasn't allowed to speak to the media, that if he mentioned anything, he would be fired. So we know this is also a labor crisis and a real moment in which protections for workers who speak up, who speak out, and who fight for safe working conditions and for their patients' rights, that they could be jeopardized or hurt in this moment. So for all of you who are helping to call attention to what's needed and are putting your jobs on the line to do that, thank you very, very much, because we appreciate what you're doing, and you are saving lives by doing it. Very disappointed with the administration on many, many fronts, but one of the things I wanted to highlight particularly to you was that we were unable, House Democrats were unable to get into the CARES package a demand that OSHA issue an emergency regulation that would lay out what kinds of personal protective equipment and what kinds of protections workers should have. It's really, really important that OSHA take that step. It doesn't need an act of Congress to direct them to do this. OSHA could step up today. They could have stepped up yesterday. They could have stepped up 2 months ago, back at the end of January, when we had here in Orange County the second confirmed COVID case. So really want them to be doing that. And I think what we've heard from this administration, instead of concrete action to establish what it means to have personal protection for each different kind of frontline worker, and then also to coordinate nationally where that personal protective equipment is going, what we've heard instead from this administration and from this president is an effort to malign healthcare workers, to suggest that somehow healthcare workers, he literally said, are selling masks out the back door for profit. And that is just a disgusting allegation to make at any time about our healthcare workers, but an especially appalling suggestion to make at this moment in time. So that was offensive, it was unproductive, it was harmful, and it's a betrayal of what he should be doing, which is protecting those who are protecting others at this moment. I have been having a lot of conversations with our hospitals, with our community health providers, with clinics and others. We're hearing about shortages of some kinds of personal protective equipment. We're also hearing about other hospitals who have a significant amount of personal protective equipment. So I talked with one healthcare unit today, and they're like, well, we only have a 35-day supply of masks. And I'm thinking, but we have other places that don't have a 1-day supply or a 2-day supply. So really, this is a big issue for the administration to be leveling this out and trying to create an even distribution of this personal protective equipment as this virus spreads and moves, so that we don't hear about stockpiles that are going to waste, as we have workers on the front line who are being wear their own masks, that they can't wear their own masks, being asked to work in unsafe conditions. So I'm well aware of this. I've heard the stories firsthand about people being asked to write their name on their N95 mask, and that they'd come back, when they came back for work the next day, don't worry, it'll have been sterilized under UV light and things like that. I know these are really happening on the front lines.
Right.
So I want to keep pushing on this. I've done a lot to push the president on the Defense Production Act, trying to get him to make use of that to increase the production of personal protective equipment, and also coordinate where it is and where it's going. We also have sent letters to DaVita and to Fresenius. They've both responded, and Jessica from my staff is on the line. We're going to be sharing more about what they said with you. We're also requesting that large corporations like Amazon take PPE off their websites and put it into the hands of a broad array of frontline workers, including first and foremost healthcare workers, including healthcare workers who don't directly care for patients, but are touching things that patients do, people who are sanitizing hospital rooms, people that are preparing and delivering meals, cleaning trays. All of those related healthcare workers are equally as exposed as some of our frontline doctors. And I think that's a really important message that we can be in partnership to help get out.
If I could jump in, Congresswoman, and what you said, and we appreciate the effort to continue to push the administration to convert existing manufacturing capacity from whatever might have been getting produced to produce PPE. We've heard in California about a hockey company that manufactures hockey equipment that's, starting to make face shields. We've heard about some clothing manufacturers that have started to do it. Can you give us any insight into the demand and the shortage is so severe? And this is really the issue that we hear about day in and day out among our members. Can you shed any light for us on the amount or the urgency or how quickly, what you as a Congresswoman understand about what the administration has in the works, to the extent it is in the works,
Yep.
about what can be produced? Thank
Yeah.
you.
So I think here's one of the real problems. I don't think the administration has any idea what's going on. To be perfectly frank with you on the PPE situation, I think they don't know what states have. I think they don't know what individual hospitals have and what they need. I think the federal coordination on this has been really, really poor. And you saw the news stories probably yesterday and today about masks being shipped to Thailand, even as we're asking Thailand to send us masks. The lack of federal coordination here is really terrible. The bright spot is we're seeing a lot of states do really good work. And so I'll just tell you about a couple things that are happening right here in the 45th Congressional District that are really exciting, and then a few things that are happening at the state level. So here in the 45th District, I'll give you two examples. We have a company called Matter Hackers, and what they do is support 3D printing. So they help teach people how to use these printers, help connect them to selling printers. Matters Hackers has set up a portal, a hub, where providers can go online and say, this is what we need, and this is the FDA specification. And then Matter Hackers is acting as a connector, a hub, to people who have idle 3D printing capacity and extra 3D printing equipment. And they're being very careful, and I had a call yesterday with their chief operating officer, to only print things to FDA standard, to make sure that we're not putting third-rate or unsafe PPE into the marketplace. And so obviously something is better than nothing, but people need to know whether they're being given quality PPE or substandard PPE. But that's an example of where we're seeing a local company step up, make use of resources, and really try to meet the quality standard. Here locally, St. John Knits, the maker of expensive women's clothes, they have lots of sewing machines and lots of capacity. They are making both gowns and masks, and that's local here to Orange County. Gap, the clothing manufacturer up in San Francisco, is making masks and gowns. 7-Eleven donated 1 million N95 respirator masks. So there is this but there is this production that's happening. What's not happening is good coordination, making sure that that production is being evenly distributed into our communities. And so I'm very concerned, even in my own district, which is very condensed here in the center of Orange County, our hospital systems are in very different situations.
Right.
And we're seeing that multiplied then across the country in terms of different states, public hospitals, private hospitals. That coordination and that delivery is really important. And I'll just say, the Defense Production Act is just a legal tool. It exists for circumstances like this when we need emergency production of things to keep us safe, but it's only as good as the people using it. And in this case, that person is the president and the vice president, and it is not being used effectively. And we're having real trouble at the federal level getting transparency into what's going on as well.
So I think if, the first thing on our list across UHW, and I know you understand that, and it's helpful to hear the specific examples, but, as much as you can do to amplify how urgent and how severe, and it has an enormous effect for our workers to be able to show up at work and feel safe and be able to do their jobs. We really need to have peace of mind that these supplies are coming from someplace, as you said, that they're legitimate and they're high quality, and that at least we know that we can do the work we need to do with legitimate and safe equipment. If I could turn to a second issue, and really something that, as we're now into the third week in most places of the shelter in place orders, which, as we all know, got extended into May. It looks like school isn't going to resume in the state for the rest of the year. And particularly for healthcare and hospital workers, our ability to do our jobs has a lot to do with, can we make childcare arrangements, where none of us were expecting, as you know, that we wouldn't have schools open and our kids able to do that. And so really the second issue I'd ask you to speak to is, what you can share with us about what the Congress is doing to help address this issue. Your own thoughts as obviously a representative in Orange County, but this, after PPE, it is childcare for us.
Yep.
And how do we as healthcare workers, if we have to be at work too, and how do we manage the economic implications aside from the political implication or the practical implications?
Yep. No, this is a great question. And it's one that I raise with every healthcare provider that we're talking to, because I think often the CEOs are not focused on this, but it's really an issue that's affecting frontline workers in a real way. So some good news on this, we are seeing in our local area. So I want to talk about what's happening and then sort of what we should do to make more happen. So in terms of what's happening, I'm excited and very happy that some of the hospitals in my area are stepping up to help their employees pay for childcare. So they're recognizing that school being out, but they still have to come to work. So we're seeing some of our hospitals and HR departments really go to bat for their employees to try to help subsidize childcare during this period. DaVita and Fresenius, two organizations that I usually don't have a lot of good things to say about. They have told us that they are helping their staff afford childcare. So we're going to be following up with that and try to make sure that happens. But that is what we need to see right now. So we're giving in Congress, switching to kind of what's happening to kind of the policy piece. Congress is giving significant money to frontline providers, to hospitals, and they need to be using this money to keep people in the workplace. And that means using the money to help their workers afford childcare. And I think one of the things that Congress did is we increased funding to the Child Care and Development Block Grant Program. And we specified that that was to be used to help increase child care availability for healthcare workers, emergency responders, sanitation workers, and other essential workers. So we provided some additional funding for child care block grants. And then the other two things we're doing is I have a bill that I've been pushing as part of the coronavirus response, which is called the Family Savings for Kids and Seniors Act, which would let workers who have those flexible spending accounts set aside more money tax-free. That amount has been frozen at $5,000 that you can set aside tax-free since 1986, when Ronald Reagan signed the bill, because a lot of people are facing this, not just with childcare, with schools out, but also with senior care.
Right.
A lot of those senior daycare facilities, senior centers, senior recreational facilities are closed.
Right.
So this would help workers set aside more of their tax dollars free to be able to do that. The last thing I'll say is just had a number of conversations with colleagues who were saying to me, well, but people who are working, they don't need stimulus checks. You know, people, my fellow Congress people would say, well, people like us, we're getting paid, we're federal workers, we don't need stimulus checks. And I have spoken up time and time again saying, I'm getting my paycheck, but my childcare costs have gone through the roof. And of course, you know, I'm able to juggle it and figure it out. And but that is a real thing. So to this understanding that just because you have a job, just because you haven't been laid off, say you're in healthcare, does not mean that your expenses have not dramatically climbed for childcare. Right. And so it's really, really, that's part of the reason I push for stimulus checks. I wish they were bigger, and I wish they were going to be ongoing for the period of this likely pandemic rather than a one-time stimulus check. So a lot of concern about that, but we are elevating this issue. It's one of my top priorities in my office.
No, and I know we have members all across the state of California. I appreciate that you mentioned elder care and senior care in addition to child care, because those are issues that we're grappling with. And on the question of the stimulus checks, one thing that we just want you to know about us and this workforce is that when we go to work in hospitals up and down the state, you know, and we're concerned about supplies, but even if we have supplies, and even if our employer is talking to us and working with us about all of these situations that arise, many of our members are scared to go home. And what they don't want to do is they don't want to bring contamination back into their house and expose their kids, their spouses, their parents, you know, people who live with them in extended families. And so we have many of our members who are literally sleeping in the garage, sleeping in their car. Perhaps they're making arrangements to stay at a hotel or a motel a couple of nights a week. And so just on your point about, yes, we all know that if this workforce is not on the front lines doing what it does, we cannot combat this virus. And we would, you know, again, just urge you to, you know, to carry that message with you, that healthcare workers are bearing a unique responsibility, because what everybody else is trying to stay away from, we're going right into when we go to work every day, and we're very concerned about what we're bringing home at the end of the day. And so, you know, that's something.
No, I really appreciate that. And it's an additional added cost for a lot of people too. And as we've seen public transportation be cut back, we have people who are trying to figure out how to get to and from in ways that are more challenging. One of the things I heard today from the University of California Irvine Hospital System was that they have actually set up a food pantry at their hospital with a box to go of food, because they're recognizing that their healthcare workers, grocery stores have shortened hours, and their healthcare workers often aren't able to get to the store. They're tired, they're afraid of spreading that contagion. And so they're trying to they're providing free to-go boxes for their healthcare workers, you know, so that they are not having to go to the store. They have sort of dinner in a box when they're heading out the door for their family. So I think there are some good ideas like that, and part of it is bringing them to bear and making sure that every corporation, every hospital is stepping up, and we're trying to even the playing field a little bit between providers and the experience that different workers are having. And that's where an organization like SEIU-UHW is so important, because you represent workforces in different units, you're able to kind of say, hey, this is happening here and this is really helping our numbers, or this is unacceptable. Everybody else is doing better for their workers than you are. Can you come to the table and improve? So I think your perspective here across these different healthcare facilities where you're working and these different healthcare jobs that you're doing is really an important one right now.
So in the time we have left, I'd ask you a two-part question here. So I think the best information that we have is that the coronavirus is likely to surge in terms of when we hit the peak, maybe late April, maybe into early May. It varies a little, but we're not there yet, right? We still have weeks to go, not days to go. And as we said earlier, supplies, childcare, recognizing the economic effects, we would encourage you, anything you can share with us about how are you collaborating with the state political leadership, Governor Newsom, all of that in terms of what you're expecting. And so what can you share with us about what to expect between our political leadership at the state level? And then what should we be expecting to hear from the US Congress, in the next 2 to 4 weeks, given just the timetable that we all think we're on? That would be helpful.
So I think the communication from the governor's office generally has been very, very good. For instance, tomorrow, the California congressional delegation is having a call with the California Health and Human Services Secretary, with Mark Ghaly. And the purpose of it is to make sure we understand what's happening in California. So really pleased with a lot of what the governor has done here in terms of the communication and the leadership. There's always more to address, but I think he's been a pretty good partner here. I frankly think the federal government is failing to hold up its end of the bargain, particularly at the administration level. In terms of what Congress is going to do next, one of my top priorities, I mentioned the OSHA regulation, trying to bring that to bear. Defense Production Act, trying to get that into use. And those are both things that we don't need to pass a bill to do. Those are things that we need to just put pressure on the administration officials to do. One of the things that I think we need to also be working on legislatively, and I'm so frustrated, it wasn't in the second bill that we passed, the Families First Act. I thought, well, that's terrible, but we'll get it next time. That's what we were told. Then the next bill comes, the CARES Act, on Friday, and it's not in the CARES Act either, and that is paid sick leave for all employees. So as you may know, employers with more than 500 employees, which includes virtually every hospital, has more than 500 employees, are not required to provide the same kind of paid sick leave that smaller and medium-sized employers are having to do. So this is a sort of egregious example of letting the largest companies that have the most capacity to actually do right by workers off the hook. So that's something that I'm focused on. The last thing that I'm focused on, and this is not maybe as much of an immediate legislative issue, although there may be, I think, an important fit here with our healthcare system, is recognizing that as the surge comes, as this pandemic wears on, each of you are going to be facing a lot of strain, a lot of stress, mental strain, mental health issues, tragedies that you're going to be witnessing and trying to help guide people through. We've already heard some really heartbreaking stories of the role that healthcare workers are providing in being with patients in their final moments without family support because of the isolation. So one of the things that we do a lot of work in my office on mental health, it is one of my very, very top priorities, is trying to enforce the parity provision in the Affordable Care Act, trying to make sure there is mental health resources available to people through their insurance plans. But I think we're also going to need to potentially appropriate funding for disaster relief counseling and mental health counseling for our frontline workers, both for them and potentially for their parents and their spouses and children. So I think a lot of kids in this country who are scared right now, but boy, I mean, like I said, my brother-in-law is a doctor. His daughters and sons are terrified when he goes to work. He takes his clothes off in the garage. Those clothes are just sitting there in a garbage bag. It's not clear what he's going to do. At some point, they're going to run out of scrubs and have to figure out what to do. But I know this is mentally stressful, and so how we think about delivering mental health resources during this time and in the upcoming weeks and in the aftermath of this pandemic is something that we'd like to be in partnership with you on.
Well, you can certainly count on us to, to be working with you and to keep you posted. And I really want to thank you for taking time tonight to join us. This is a live stream event that's viewed by our members all across the state of California. And again, just on behalf of everyone in UHW, we want to thank you for your advocacy on testing, your advocacy with DaVita and Fresenius, and for really being an ally for healthcare workers and regular working people. We really appreciate what you're doing. And you can count on us to be there as we continue to go through this, and anything you need from us, just let us know. And again, thank you so much for joining us tonight.
Thank you so much for having me. Thank you.
Great. Thank you, Congresswoman. So before we turn to Georgette and the members of ours from Kaiser Permanente, I just want to emphasize, what we've been focused on across UHW, and it touches on something that Congresswoman Porter said, that it is such a crazy environment out there, and the confusion that exists around employers trying to find PPE supplies. Everybody's out searching for the same items, whether they're masks or gowns or face shields or swabs or disinfecting wipes, what have you. And I want people to know that we have really sounded the alarm with our employers. We've been in daily communication. We're hearing from lots of people who say they have supplies, and we're trying to work with all of the procurement officers and the buyers from the largest systems down to independent standalone hospitals in the state. So that's one thing we've continued to work on. Second thing we've done, and it's really a local situation, is we've tried to connect up people who have equipment or who have supplies and are willing to donate them to healthcare workers and healthcare institutions. And I just know today that in San Diego, we had an example of a donation that was received, and our members down there at Tri-City Medical Center were, really pleased about that. So that's something we've been working on. And then the third thing we're doing is we're just trying to make sure, again, that we're operating as a clearinghouse, and we're sharing information, and we're there as a resource for people to be able to turn to and try to get questions answered. So that's something we're going to continue to work on and do the very best we can. And we want to turn now to being able to hear from some of our member leaders about how they're dealing with issues on the job in hospitals around the state. And I want to hand off the conversation to Georgette Bradford, who is a Kaiser member in the Sacramento area and has really been working at her facility and in her region and with our coworkers, to give a perspective on how we're handling a number of the challenges that we're facing. So Georgette, I'm going to turn it over to you.
Hi, good evening. Thank you, Dave. I want to thank again Representative Porter for joining us and everything she's doing to help protect healthcare workers. But I do want to go to something that she said that really resonated with me. It's obvious to all of us this is a healthcare issue, but it truly is a labor crisis. It is a labor crisis in that a lot of our members don't necessarily feel, and I'm just going to be honest, Disneyland is closed, so I'm not going to give you the Disneyland version, that a lot of our members do not feel protected. We have a lot of front-facing members from EVS, respiratory therapy, lab, pharmacy, receptionists that deal with the public on a day-to-day basis in person in closed quarters. And these members feel that they are expendable, that doctors and patients count, but their lives don't, their families don't. So that's why this is such a labor crisis. And that's why the work that we are doing is so important, because now more than ever, we need to be working in partnership with our employers. We need our e-board, our e-com, our stewards, every single member engaged in the process of getting through this crisis. And I think that's what's so wonderful about the checklist that we have that have been rolled out. First, the original checklist for coronavirus, but also the surge checklist as well. And for me, what I would definitely like to stress is the importance that it's not just for someone who's an elected leader. This is for every single member, because these lists help us know what Kaiser should be doing. And if they're not doing it, we are all individually raising the alarm. 1 or 2 alarms being raised is not as loud as 100,000 alarms being raised, 150,000 alarms being raised. So that we are holding Kaiser accountable real time every day, and what they need to do, as they should be doing, which is morally right, to protect their healthcare workers. A receptionist family is no less important than a doctor's family. So I think that's why it's so important that we are doing this checklist. So I just wanted to say that because this is the sentiment that is out there right now, and it's real. Right. And these members are scared, as they should be. This is something that has never happened in the past century, if ever. So this is new to all of us, but at the same time, we need to do this together. And Kaiser needs to understand that they need to involve labor at every level, because we are the ones that are putting our lives at risk. We are the ones that are not sheltering in place, so we can be there for our patients. But that means that we also need to be protected.
Right. And just a quick point on that, Georgette, in the run up to the event that we're doing right now, we had the checklist that was scrolling through on the Facebook page. And I just want everyone who's watching this to know that if you haven't seen the second checklist, which is really a surge checklist in addition to the original one Georgette talked about, it will be on the website at www.seiu-UHW.org. It's a good tool, as Georgette said, to use in any facility in the state about what your employer ought to be doing. And the other thing I just wanted to emphasize, and I should have mentioned it before, Georgette, is because of people feeling the way that you've described, scared, and in too many cases expendable, and that we don't count as much as physicians or others. We've also launched an effort to get our members to tell their stories about what they're confronting, and to really speak to the kinds of inconsistencies and problems. And so that's something that we're going to be working with people about. And I just wanted to mention that. I know there's more you want to work through, but just wanted to put those two in there.
No, thank you, Dave, because it is important that those voices and those stories get out so that people actually hear directly from the frontline workers what our reality is, because there's a big difference between recommendations and realities. Kaiser's policies and what we are living day to day. And those stories allow everyone, including Kaiser, to see that. But with that being said, these checklists and these voices being raised, these alarms being rung, has led to some really phenomenal work. We still have a lot more work to do, but we want to make sure that our members are knowing the work that's going on to make sure that they are protected. Conversations are being had at every level, including up to the very top with Greg Adams, and it ensured that we were getting some more protections. Like I said, we're not done yet, but making sure that as we go, we are getting the protections for our lab, our pharmacy techs, our receptionists, our EVS, who are really, really in the trenches. Right. So I would like to ask Lee if she can tell us a little bit more about what they've been doing as far as some of the protections they've gotten started for some of our frontline staff, like our receptionists.
Hi, this is Leah. So a few weeks ago, the pharmacy clerks and pharmacy technicians were voicing concerns about their safety and the patient's safety regarding the proximity between the clerk and the patient. We brought this concern of the protective barrier to local pharmacy leadership. Labor's concerns were brushed off. We were laughed at by our local pharmacy leadership. So then the concerns were escalated to Kaiser's regional and national level. It wasn't easy getting the protective barrier point across at either regional or national level. However, we did prevail. Beginning last Wednesday or Thursday, the protective barriers were installed across the state. And now the protective barriers are beginning to be installed in emergency rooms across the state, reception, and in the lab.
And just to give a little bit of a sense of the scope, we're not talking about 2 or 3 places here. We're talking about barriers, plexiglass barriers being installed in pharmacies and now reception areas and lab areas in hundreds and hundreds and hundreds of work locations. And that's both in Northern California and Southern California. And it started exactly how you described it, Leah, as a result of, member leaders having a conversation at a local level and then pursuing it. So I just wanted to, flesh out a little bit that this is not a localized response, but it's now turned into a system-wide response that began exactly as you described it.
Thank you, Dave.
Go ahead, Georgette. I think you're.
Yep. So thank you, Lee and Dave. Not only are we protecting those front-facing members, but we're trying to reduce the exposure overall. If you can work from home, then we want to get you working from home. We've got managers, we've got directors working from home, we have some of our clinicians working from home. But if our members have the ability to work from home, we should be doing that. And so that was a big push as well. And part of some of these checklists was, what can we get done to get as many of our members to move to working from home? And as it stands right now, we have moved large numbers of our members to work at home, which is including about 2/3 of the Kaiser call center, Dignity Common Spirit coders, patient financial services throughout California. And the more people that we can feasibly get to work from home, that's less exposure to their families. It's also making PPE more available in the facilities as well, because they're no longer in the facility. So I wanted to make sure that everyone knew that is a big push along with getting the PPE, is if we can get the work done from home, we need to be able to do the work from home. In addition to that, we are looking at the big elephant in the room, the masks. When everyone talks about PPE, the main thing we are thinking about are masks. And we all know there was a shortage. There weren't enough masks to go around, and it wasn't just for Kaiser, it was a nationwide shortage. But what were the options? What could we do? Just like Representative Porter said, something is better than nothing, but our members were being faced with nothing, to the point to where they were being resourceful, bringing their own masks, purchasing their own masks, only to be told they couldn't wear them at work. So that is when, again, the voices were raised, the leaders came forward and advocated every level of leadership at Kaiser, all the way to the top. Why can we not bring our own masks if you cannot supply them for us? If you cannot protect us, let us protect ourselves. And based on that, there were changes in policy at Kaiser, Sutter, and Dignity as well regarding mask usage and bringing your own masks.
Yeah, and just on that, because I checked on this literally while we've been on the this live stream event, Georgette, and I just want to add that in addition to Kaiser and Dignity and Sutter changing their system-wide policies to allow people to bring their own masks in, we've also now had the same success at Tri-City Hospital in San Diego County, at HCA West Hills Hospital, at Providence St. Joe's, and also at Hollywood Presbyterian. So this is something that, because of member leader advocacy, is spreading across the state, and there have been a number of successes. On the negative side, though, I want our members to know that the one hospital that has really dug in and been a problem on this is City of Hope in the Los Angeles area, where they have refused and continue to refuse, but we're still in conversation with them about it, and that's one we're just going to have to bear down even harder. But those other ones have had the same kind of success that you mentioned. And Georgette, I think, I'm not sure, you correct me if I'm wrong, but Yvette, who's a call center worker, and the whole,
Yes.
is she gonna, I just wanted to know if, okay, go ahead.
So I just wanted to shoot this over to Yvette so you could tell us all the work that's being done, specifically from the point of view of the call center.
Okay, so I work in one of the mega, good evening, everyone. I work in one of the mega call centers in Southern California, and I'm kind of stunned a little bit. So let me go ahead and just give you an update, and then I'll tell you what I'm stunned about. Is that, okay, so I got a call like 8 o'clock at night from Jonathan Everhart saying him and Vicky was on the phone with Kaiser. Kaiser said, we need to get the people out of the call centers. So I assumed that that was Northern and Southern. So I get into work. My manager, she's on rampant to distance us. We were like In-N-Out Burger. We were getting these people out. Whoever wanted to go home, who qualified for the minimum, we got them out. I was multitasking because Jonathan also asked me to check on the many call centers. So I'm just multitasking. I'm even got a cart and I'm taking equipment down to get the employee to their cars, which that's usually IT. So I was doing a lot. So that was what was going on, you know, once I got that call. Then I was starting to get responses back from the smaller call centers saying, okay, that Kaiser kind of stopped us. We can't send anybody home. See what you can do. I reached out to Jonathan. The next thing I know, I get a response back during the Teams chat saying, Yvette, I don't know. I didn't even know that I was making a change or helping. They was like, Yvette, I don't know what you did, but now we can send our people home. We're sending our people home. And those are the smaller call centers. So that started like 2 weeks ago. So now we're at a standstill to where everyone who's distant, who wants to remain in the call center, we're social distance. Then we have some that want to go home, and this is the craziest thing that I've seen. To look like that this is not one thing, it's another. We've been looking for toilet paper, paper towel, hand sanitizers. Now there's a shortage on desk, office equipment, and chairs, so we can send people home. There's also another issue to where the people who does the internet hookups for you, they are afraid to come in people's home and hook up internet service. So it looks like, you know, if it's not one thing, it's another. So for right now, for UHW South, we have, for all the mega call centers, we have 625 people working from home. That's total. Then I was on the call, a conference call between the North and the South, both of us for call centers the night before last. And then I heard that Northern California, Kaiser, which I all thought we were one Kaiser, one family, we're just one through all of this. Some of them are still working on top of each other. That's what we call this when you're not sent.
Whoops, Yvette, we lost.
You can have pods or cubicles, and you can have 6 people at a pod in my call center. And then we hold 174 people. That is too many people to be on top of one another. That's why we had to get them out. So my heart goes out to my brothers and sisters in Northern California who was on that call saying that Kaiser has not sent them home for whatever reason that it is. Then there's a shortage, which that is going to be my new fight right now. There's a shortage of hand sanitizers and the desk wipes for us to clean off the desk for the people who still are in the call centers. So we have a lot of things that, like, it's a good thing that we got some people out, but I don't understand what's going on in Northern California. And if my voice can help my brothers and sisters up there to get these, for them to see this video and, you know, get on Kaiser, like, look what's going on in the South. They got 625 and still counting, sending people home. Then I hope that's something that can help.
Great. Thanks, Yvette. And again, just to, I think certainly our Kaiser members know that Kaiser operates a northern region and a southern region. And on the issue particularly of call center employees being able to work from home, the southern region has been faster and quicker about making that happen. And we are now at 2/3 of people. It's not perfect. There's still glitches and problems we have to work out. But we really are committed to getting in Northern California as well, the same thing, and getting, you know, that when you total it all up, it's thousands of people who then, you know, are able to continue to do their job and do it in a much safer way. And again, allow us both to take care of patients, but protect ourselves. So Georgette, do you have any other issues you'd like to cover before we turn to Kevin? Oh, you got a There you go, Georgette. Go ahead.
There's one more thing that would be remiss if we didn't talk about, that is the fact that a lot of our members have children. A lot of our members' lives have been turned upside down with the schools closing. At first it was one school, and Congress said, let's see what happens. Now it's all of the schools. So you're looking at schools being out pretty much until the end of the year, and not everyone has another spouse that can stay with the kids. You have a lot of single parents, or both parents are healthcare workers. So they are both essential employees, so to speak. And how do they get childcare? How do they afford it? This is not an expected expense. Another side of that labor crisis. So that was some of the work we've been doing. And there have been, actually, through the work with our local and state government, which kind of goes to a lot of the relationships we've built through our political work, we were able to come back and say, hey, we worked to get you there. Now you need to help our members because they're in crisis. And so in that, we were able so far to locate local resources in Burbank, Kings County, Los Angeles, Lancaster, Marin County, Mariposa, Palmdale, Pomona, here in Sacramento, San Francisco, Tuolumne County. We're still updating our list regularly on the SEIU website, but if you go to the page, there is actually a link where you can click to find out about child care resources that are constantly updated. Some are free resources and some are at a reduced cost, but we're constantly sourcing those out so we can make those available to our members, because we want to make sure that we are not breaking our members' backs financially because they're out taking care of America, basically.
Great. Thank you, Georgette. And I think this might be right. I think we're up to 12 cities or political jurisdictions where we've now got formal arrangements to provide, either free or subsidized childcare, particularly with, a mind towards healthcare workers and being able to support them. And as you said, can always check the website and be able to see what's on there. So I'd like to turn to Kevin Barraza from Dignity Common Spirit and really ask him to give his perspective on, preparing for the surge. And as we've gone through this, we were in an evolving conversation with Dignity. I know Kevin has become a fixture in his facility level, daily meeting around how to be safe and how to, take care of each other. But Kevin, if you could talk about the surge checklist from your perspective and what you've experienced at your facility in Santa Cruz.
Sure, Dave, thanks. So, this surge checklist has really been a good tool to, hold the employer accountable and make sure that they have policies and procedures in place that are streamlined to ensure the safety of our healthcare workers, but also to ensure that we have healthcare workers to provide quality care for our communities. This surge checklist was made up of a bunch of questions that we had formulated for the employer to really show them that, one, you need to definitely partner with us in these times. And two, we're going to hold you accountable when you're not adhering to these things on this checklist. So in my area, it's been really useful, driving the conversation, and they're, a little bit surprised when they get it, like, whoa, this is pretty comprehensive here. And, and I told them, I said, look, at the end of the day, we need a partnership. We need a partnership, and we need your commitment to continue to work through these issues with us if they're not in place. Fortunately for myself here in Santa Cruz, that commitment has been, and the dialogue has been extremely open and well received from the employer. I would say why this checklist matters the most is because at the end of the day, we have our healthcare workers that we're leaders of these facilities. We filled a lot of these questions and concerns. And so, being a part of this is extremely important, right? And what I would say to all healthcare workers is that this checklist is important for all of you, not just your leaders of your facilities, not your organizers of your facilities. this checklist is your checklist. Own it, hold the employer accountable, make sure that they're adhering to these things, and if they're not, sound the alarm. Because, go ahead, Dave.
I was just going to say, can you give an example or two just of conversations you've had, Kevin, just to kind of illustrate how people can approach it?
Yeah, so you know, I'll give you an example, but let me just really quick just go through, like, you know, what the checklist is built of, right? So it's facility protection, PPE, staff exposure, surge, well, space capacity during the surge, surge staffing, and support. So really how I've been driving this checklist is making sure that, you know, they let me know, what are our daily supplies look like? What are the inventory? And at first, you know, there was a little resistance to be transparent, but at the end of the day, when you stop providing masks to our employees and tell them to bring in their own, we're going to know what your resources are, right? So it's better to be transparent now, because at the end of the day, we as healthcare workers and our organization, UHW, is really a driving force in getting the proper PPE for our members, right? And for not just our members, for the healthcare community in itself altogether, right? So, you know, there's been talks about that. There's been talks about how I've utilized it is, you know, what are you doing to ensure that there is not direct contact with patients, you know, if they are sick, right? And so I know in Kaiser, they've brought up the whole plexiglass barriers, right? So that's another way, you know, that was a great idea. And I started to drive that at my facility. And now they are working with engineering and a couple other areas to figure out how can we get these barriers up and how long is it going to take, right? So those are just a couple examples. The other thing is, you know, what are you doing to prepare for the surge, right? I got to call the question. Today I was on a call with them. What are you doing? And so they're starting to create these pools of people who may be called off, those who have recently retired, who they may be able to call back into action. Those are some steps that they're taking as well. So, you know, it's a good tool. And what I would say is all healthcare workers should have this checklist and really make sure that our management teams, our leadership teams at these hospitals are adhering to it to the best they can to protect the workforce, so we can ensure we can still provide the best quality care possible for our communities.
Great. Yvette, did you have something you wanted to add to that thought from Kevin?
Yes, I feel that we as union members need to hold Kaiser accountable to cut some of the red tape. Some of the red tape to get people to get home, to work from home, not be complaining about the equipment and stuff like that. We took people's computers right off the desk. So I think that's kind of what's holding up a lot of stuff, is the red tape. This is a serious virus. It's our lives are at jeopardy. And I think that that's what we need to hold Kaiser accountable, to cut some of this red tape.
Great. And I think part of what I'm taking from Kevin's comments, and you know, I just want to emphasize that, as I understand it, Kevin, and correct me if I'm wrong, but you are involved in a daily conversation with a leadership group at your facility where you have the ability to raise any kind of issue you want, where it's an ongoing dialogue. It evolves over, it's not a once a week thing, but it's literally every day. And so, you know, whether it's an issue with call center people or coders who could work from home, or physical barriers or what have you, you know, I hope that what everybody watching this takes away, you know, there's no magic bullet here. This is about daily engagement, and we have to recognize we're in the third week, and this could be going on for several months to come. And the more that we're doing the kind of stuff that we're hearing about, you know, happening at your facility, Kevin, I just think that's, you know, that's an important thing. But did I get that right about how you engage with the leadership at your facility?
Yeah, so because I've been in contact with the HR manager and director so much, they basically said, we're going to add you to our 9 o'clock task force meeting call And so, you know, I told them, I was like, yes, I'll be on it. And I've been on it ever since the invite, and it's a lot of good information. And they've called on me a couple times in this call to say, do you have any questions? Do you have any concerns? We want to make sure we're covering everything. And I would say that this all started after these checklists went out, right? And, you know, I kept voicing concerns from our healthcare workers in our facilities, and they know I'm going to be relentless in this, and I'm going to push hard. But I also, you know, at the same time, empower, you know, our healthcare workers in our facilities to take charge. Don't sit back and wait, because you can sit back and wait, and it is going to be too late. Your voice, there's a reason why you're a part of this great organization called UHW, right? You have a voice. Use that voice. And even if you aren't a part of an organization as like UHW, you still have a voice. You are protected as a healthcare worker. They need you more than ever. So make your employer understand that they, you know, they need to work with you, right, to ensure your safety, so you can provide the best care you can for your communities. I mean, I can go on and on, but I'm not.
No, I think, look, as happens every week, the hour goes by really, really quickly, and we've gone through the hour, but I think that's a perfect note to wrap up with, Kevin. And I just want to remind, you know, if you work at Kaiser, every facility has what they're calling a command center. If you work at Dignity, there's a task force at every facility. Every hospital, every system has some sort of a leadership group that meets every day, talks every day about how it is that we're dealing with the virus, how it is that we're working on safety and other workplace issues and items. And we got to be in that conversation. And I know Georgette believes that, and Kevin was talking about it. Yvette, from her perspective, as a call center worker, and I think Leah's example earlier tonight, you know, that because we're engaged in those conversations, concrete things are happening that are making our members safer, making our jobs better, and we're committed to continue to do that. So I just want to conclude by thanking everybody for, you know, joining us for this. Again, we're going to do this every Wednesday for the duration of the pandemic and the COVID-19 situation. The mission in UHW, the thing we get up every day and think about now, is how do we put our members in a position to be safe and effectively take care of the patients that we care about. That's what we're all working on. I appreciate Kevin and Georgette and Leah and Yvette and so many other leaders across the state. But thank you everyone for joining us tonight. We'll see you again next week. Check out the website, www.seiu-UHW.org. All of this information is up there. You can leave us comments, and it makes a difference in terms of how we do things. So be safe, have a good evening, have a good week. Thank you.
Thank you.
Thank you.